Hi, I'm Dr. Brandon Elnekaveh, and I'm a plastic surgeon here at the South Florida Center for Cosmetic Surgery. If you've been struggling with loose abdominal skin, stretch marks, separated abdominal muscles, or stubborn belly fat that just won't go away no matter how much you diet or exercise, this video is for you. Today we're talking about one of the most transformative procedures we offer. That's the tummy tuck, also known as the abdominoplasty. Pregnancy, weight changes, aging, these things can all stretch the abdominal skin, separate and weaken the abdominal muscles beyond their natural limits to recoil back. And unfortunately, when this happens, no amount of crunches or clean, healthy diet can reverse those changes. That's where the tummy tuck comes in. A tummy tuck is a surgical procedure that removes the excess hanging skin and fat of the lower abdomen, and it repairs the rectus diastasis, or separation of the abdominal muscles. You have two rectus abdominis muscles that run up and down side by side in the front of the abdomen, and a diastasis is just a separation of those muscles. What we do in a tummy tuck is plicate or fold in the tissue between those muscles to bring the muscles back together to the center of the abdomen, because what happens when they're separated is there is a weakened area in between, and the abdominal contents and pressure can push that out and create a more rounded abdomen. Rectus diastasis is a very common problem that many women face after pregnancy and childbirth, but also can happen after weight changes or significant weight loss. A tummy tuck or an abdominoplasty addresses three main things. First is the loose excess hanging skin at the bottom of the abdomen. Second is the weakened muscles that we bring back together. And third, we often do liposuction on the sides of the abdomen to create a more curvy silhouette and smoother contour. There are different types of tummy tucks depending on your needs, anatomy, and goals. First is the full tummy tuck. This is the most common type. It addresses all the areas of the abdomen that we've been talking about. Next is the mini tummy tuck. This is ideal in a certain small group of patients that have a very small amount of loose extra skin at the lower abdomen, but don't really have that separation of the muscles. So what it entails is that same lower abdominal incision from hip to hip, removing that skin at the bottom, lifting up that pubic region, but not really bringing those muscles together or moving the belly button. This involves a shorter incision and a quicker recovery. An extended tummy tuck goes a little bit further than the hips to the sides of the abdomen. This is typically reserved for larger patients that have excess skin or fat that goes further than the front of the abdomen all the way to the sides. And often we use it with patients who have significant weight loss. Keep in mind that this includes a longer incision and allows for a more extensive contour. Finally, we have the fleur-de-lis tummy tuck, typically used in patients who have massive weight loss, patients who have typically multiple folds of fat and skin, because we're able to address not only the vertical component, but also the horizontal component of the excess fat and skin. So what that entails is that lower abdominal incision, and then also a vertical incision going up and down the belly in order to tighten up the skin from the sides. You're a good candidate for a tummy tuck if first you're at your ideal weight, you have that loose extra skin or separation of those muscles, and third, if you're done having kids. That's to say, if you do want to have kids after a tummy tuck, it may change the results, so it's best to wait until you're ready. Having said that, it's perfectly safe to get pregnant or have children after an abdominoplasty. Tummy tuck recovery varies from patient to patient. Typically, patients are going to be bent over at the hips for about a week, sometimes more, sometimes less. There's going to be bruising, swelling, some numbness, maybe even tingling and shooting pains. These last about a week or so and do typically improve, although there's going to be permanent numbness between the belly button and the lower incision. You'll have a compression garment for multiple weeks in order to compress the area, give you comfort, and shape the abdomen as well. I do encourage patients to walk early. And of course, it's very important to make sure that there's no heavy lifting or strenuous exercise for 6 weeks. What about scarring? We're able to put that scar low on the abdomen, hide it in the bikini line, and put a scar around the belly button with an incision or scar that's hidden on the inside. The result? A flatter, stronger midsection, improved posture, and a huge boost in confidence. Many of my patients say that they finally feel like themselves again. If you've been thinking about a tummy tuck or want to just explore your options, we're here to help. Every body is unique, and your surgical plans should be too. We'll walk you through everything, answer all of your questions, and design a solution that's right for you. Call us at 954-565-7575 or visit our website to schedule a complimentary consultation. If you found this video helpful, give us a thumbs up, subscribe, and stay tuned for more insights.